thank you so much for inviting us to speak to your residents in Gwinnett County. I am the Director of Communications and Strategic Partnerships here at CVI, and we are located at 739 West Peachtree Street in Atlanta, right around the Georgia Tech area. So the mission of the Center for the Visually Impaired is to empower those impacted by vision loss to live with independence and dignity. We serve everybody or anyone who is experiencing vision loss, from partially sighted to fully blind, regardless of their age or income level. We start even at 6 months old and go into senior citizens. We tailor all of our services to the needs of individuals at whatever stage of life they're in. So it really is tailored to them and what their goals are and what they're trying to accomplish. We do have a retail store that has a wide variety of aids and different tools for people who are visually impaired. And again, we are centrally located in Midtown. We are just down the street from a MARTA stop, as well as we do have a parking lot, which is very beneficial for a lot of folks. So I'd like to start today by just talking about what is low vision. A lot of people don't really know what that means exactly. So according to the American Academy of Ophthalmology, low vision refers to vision loss that cannot be corrected by medical or surgical treatments or conventional glasses. So even if you have glasses and you still are struggling to see, then you potentially have low vision. 12 to 15% of older Americans report having vision loss, and 25% of adults over the age of 75 have low vision. So some of the causes, especially as we age, of low vision are things like age-related macular degeneration. About 2.7 million people in America have age-related macular degeneration. Diabetic retinopathy is another one. There's over 7 million people in America that are experiencing diabetic retinopathy. And glaucoma is another one, among many other things like retinopathy pigmentosa, excuse me. But the main three for individuals as they're aging are age-related macular degeneration, diabetic retinopathy, and glaucoma. Some of the signs that you may be dealing with low vision is that maybe you can't see faces very well anymore. Maybe reading anything from newspapers and magazines to your bills, or maybe your medication bottles that you're really struggling to see even if you have corrective glasses. Maybe struggling to manage your finances, or even just signing your name to different paperwork, at the doctor's office or wherever it might be. Maybe you like to use your computer and it's still kind of fuzzy when you're looking at the computer. And of course, watching television as well can also be a sign that you are experiencing low vision. So if you are experiencing low vision, one of the things that you might want to consider doing is coming to CVI or looking at what are some of the things that you can do to make life a little easier. People come to CVI once their vision has gotten to the point where their doctors can no longer treat their vision loss medically or with glasses. And a lot of times the doctors will recommend you come to us. But if your doctor doesn't, something for you to keep in mind as well. When you come to CVI, most of the time you will start in our low vision clinic, the Florence Maxwell Low Vision Clinic. And what we do there is provide exams and vocational rehabilitation to support your independent, active living. That includes a specialized, or an exam, with a specialized trained optometrist. They specialize in low vision. They'll evaluate your usable sight and talk with you a little bit about your goals and some of the things that you want to be doing that you're struggling to do, and make some recommendations on how to enhance the quality of your life with the vision that you do see or do have. After that, you will go see the occupational therapist who also specializes in low vision. And she will introduce you to some lighting and magnification options for things like reading and writing and just performing some daily activities. The client's level of vision is assessed in kind of between the doctor and the occupational therapist. And then they together kind of come up with some different recommendations just to make things easier for you in your daily life and to help you remain independent and being able to stay active and do the things that you've always enjoyed doing. So in addition to just talking about tools and devices and things and some techniques, they may also recommend that you look into some adult services or training that we have here at the Center for the Visually Impaired. Clients can choose from different classes around things like orientation and mobility, for instance, using a white cane, just getting around safely, navigating your home or work. And maybe it's your neighborhood and you want to be able to take a walk in the neighborhood, or using public transportation, any kind of new environment that you might encounter at a doctor's office, perhaps, or at the grocery store, things like that. We also have classes that are around what we call activities of daily living, or ADL, as we say for short. And that includes things like cooking, cleaning, maybe it's doing your laundry, maybe you struggle a little bit with that, being able to manage your clothing, for instance. There are ways to label your clothing and other things so that you want to make sure your clothes are matching, and maybe you can't see that as well. So there are lots of different things that we can help you learn how to do and just do a little different than you were in the past to make everyday living easier. We also do technology training. So that's taking advantage of some of the smartphone features, such as voiceover, being able to read your emails. Maybe it's reading a text, you can have it read out to you. You can speak a text response, things like that. We also have keyboard training. Maybe you need to learn how to type again. If you use your computer a lot and you're struggling, there are programs, one's called a screen reader, that actually reads what is on the screen to you. But we also have software that will magnify the screen so that if you still have some great usable vision, that's a way to be able to enhance your interactions or engagement with your computer and being able to stay connected with people. And that's really about what it's about for when it comes to technology in particular, is just being able to stay connected with your friends and family through your cell phones and through the computer. We also have support groups that there's one that's every Thursday that is for everybody, including any caregivers or family members or anyone else who wants to come, because they also might be struggling with how to deal with and support you as the person who has a vision or is experiencing vision loss. And so these support groups are really great in just giving you, helping you get the confidence back that you have lost, and maybe you can see from others' experiences that there is still so much that you can do, even when you're dealing with vision loss, and just learn from each other and support each other. So in addition to those trainings and skills that we can teach you, there are some accessible solutions that are recommended by our occupational therapist. There's what we call optical tools and non-optical tools. And so some of the optical tools that do make life a little bit easier for you, range from optical handheld or stand magnifiers that help you read newspapers, and if you want to read the books, or maybe you're doing some grocery shopping and you want to be able to read the labels on some of the items that you're looking at. You have some different sized handheld magnifiers that you can take along with you. And then there's some other tools and devices that also assist in that. We have what we call spectacle magnifiers, which are some glasses that also have sort of like, I want to call them binoculars necessarily, but similar to that, that do magnify. So maybe you still have enough vision, but you're struggling to watch television. Those are a great option for people. We have electronic aids and magnification devices as well. So digital magnifiers that usually have a little bit of a stand, and you can set them on top of what you're reading. They also come with some contrast things. So it may be changing the screen on those. It makes it a lot easier for people. If, white on black or black on white doesn't work for you, maybe there's another color combination that would, and those devices have that capability. And then again, I mentioned screen readers and screen magnification software that can be added to your computer. Some of the non-optical tools are doing things like changing the lighting and the position, intensity of the lighting that you have. Sometimes it's better to have the lighting directly overhead versus coming at it from the side. That changes your ability to see things a little bit better. We have things like talking watches. There are telephones with large buttons and that can talk to you. Talking clocks. So a lot of different types of things like that just make it a little bit easier for people if you can't quite see the screens on those. The idea of minimizing the clutter in your home is a huge, really important way for people who are visually impaired to minimize the risk of falling. That is certainly, I think, one of the bigger factors for a lot of people is, how do I navigate my home and do it safely? So that's something that is an easy tip for anybody to think about. It might be, from your bedroom to the bathroom, so that if you are trying to walk maybe if it's even at night when there's no lighting whatsoever, maybe it's dark, making sure you have a clear path to different places within your home makes it a lot easier. We can teach you, there's little techniques on how to fold or collect cash a certain way so that you know what denomination. So that can be very helpful if you are someone who still carries cash. Again, I mentioned labeling clothing earlier. That's actually a really great tool so that you know that things are matching in the way you want them to. We have specially designed kitchen tools that also make cooking a little easier. There's an image on the screen of, there's a lid that goes over a pot. So if you're boiling water and you're cooking, whether you're cooking pasta or you're cooking vegetables or something, and you need to get rid of the water without spilling or splashing, this lid is a great tool. It's just one example of one of the tools that can be used that will keep you safe and help you with minimizing any burning or making a mess because it's gone everywhere because you couldn't see what you were doing. All of those devices that I've just gone over are actually available in our store. We have here at the Center for the Visually Impaired, we have an on-site store called the Visibility Store. It's the largest and the only retail store in Georgia where you can actually come in, try out some different devices, test. If you're looking for a handheld magnifier, depending on where your vision is, you're not sure if you might need a 3 times or maybe you need a 5 times magnification. So you're able to really test out and see which version is going to be the best for you. The other piece of that is we do recommend and really encourage you to go have a low vision exam with the doctor before you come into the store for certain things, because it'll depend on what your goals are and what the doctor and the occupational therapist recommend, so that you know what kind of tools you might need and what would really be beneficial, as opposed to just buying things that maybe perhaps you don't really need. One of the other things we do have in the store that I didn't mention earlier is something called a CCTV monitor. They're large monitors where you can place a book, newspaper, etc., on a platform, and then there's a magnification and a screen above you that blows it up to a larger vision, so that you can see what you're reading a little bit better. So that's also something we do have in the store. And we also have things like, cards. If you like to play cards, we have large print cards. There are large print crossword puzzles, so there's a lot of different things out there for people who are experiencing vision loss to continue doing things you love to do, remaining independent, and we are happy to help you with that. And our store manager, if you can't make it into the store, if you have a question about something, she's always happy to take phone calls and perhaps place an order for you and mail it to you. I'd also like to just make sure that everybody is aware that the Center for the Visually Impaired is a nonprofit. So we do not turn people away. And so no matter what your income level is, if you are on a fixed income and you are concerned that maybe you couldn't come to us because you thought that it might cost a lot of money, there are absolutely tools and things that we can do. We do have financial assistance. It covers anywhere from 10% to 100% of the fees for eligible clients. The low vision exam is covered by most insurance, so we can always ask about that as well. And then we do have a solutions fund for assistive devices as well. So you may be able to get a little bit of assistance if you have a device that you really want, but you can't quite afford it. There may be some options there as well. We are able to do that through the assistance of generous donors, whether it's corporations, grants that we've received, and or general donations from individuals in the community. So just a little bit of information about kind of how CVI makes a difference. We serve a little over 1,000 to 1,200 people a year. We also serve as a resource for individuals. They may not necessarily need our services, but maybe they're looking for audio books or different things, different resources and things like that. We are also there to help people from a resource perspective. We cover 28 counties in Metro Atlanta, but anybody can come to us throughout Georgia, should that be something that they would benefit from. 60% of the people that we serve are below the federal poverty guidelines, and 50% are from communities of color. And we have something that might also be of interest to you all. It's called InfoLink. It is a weekly email that goes out. We also have a recorded version of it, so should you want to call in for that. But we send that out to subscribers who would like to, one, keep up with any updates from us as far as our support groups or other activities and things that we have going on. But also we receive information from other groups that serve people who are blind or visually impaired. And so they will send us information about different activities and meetings and things that they have going on, and we'll share that in the InfoLink newsletter. So that's always a nice benefit for people. And so, how can we help you? And yes, can we help you? We can, absolutely. So the main thing to take away from this is, if you are experiencing vision loss and you're not quite sure what to do, give us a call. We can help you stay independent and continue doing the things that you love to do and remain active. What you'll have to do, we do require a diagnosis and what we call an eye report from your doctor within the past year for you to make an appointment. So that is an important piece of it. You do have to have that referral or that information from your doctor so that our doctors can be sure that they know what you're dealing with. You can always, as I said, you can always visit the store. You don't have to come in for a low vision exam to come to our store. So the store is open Tuesday, Wednesday, and Thursday from 8:30 to 4. And then on Fridays, I believe it's by appointment only, and half days on Mondays. So if you are struggling with low vision, please do give us a call. I also like to just encourage people that if you are already aware that you have any one of the eye diseases I mentioned earlier, or you are experiencing some form of vision loss and you know it's going to get worse, go ahead and give us a call, because the sooner you can learn to do some and learn some of the skills that it takes to maintain your independence, the easier it will be. So if you still have some vision, maybe it comes and goes, but you do have some vision available, that makes it easier. And so that you'll already be prepared for the progression to when it gets bad enough that you really can't see and do things anymore. And that's really all I have for today. Again, the Center for the Visually Impaired is located at 739 West Peachtree Street in Atlanta. 30308 is our zip code. The phone number to give us a call and talk with any of our specialists about your situation and potentially to schedule an appointment is 404-875-9011, or you can email us at clinic@cviga.org. And our website is www.cviga.org. And thank you so much.